20 years old and no menstruation. Understanding the causes and finding solutions. Not having your first period by the age of 20 is considered abnormal and could indicate a range of potential causes, including a lack of ovarian development. To fully understand this situation, we need to delve into the causes, potential impacts, and available treatments. Causes of no menstruation at 20 years old. Underdeveloped ovaries. This occurs when the ovaries are unable to produce female sex hormones estrogen and release eggs for ovulation, leading to delayed or absent periods. Causes of no menstruation at 20 years old. Polycystic Ovarian Syndrome PCOS. This common hormonal disorder involves enlarged ovaries with numerous small cysts, disrupting ovulation. Causes of no menstruation at 20 years old. Pituitary Gland Hormone Deficiency. The pituitary gland is a crucial endocrine gland responsible for hormone production that regulates menstrual cycles. A deficiency in pituitary hormones can impact both periods and ovarian development. Causes of no menstruation at 20 years old. Eating disorders. Unhealthy eating habits, nutritional deficiencies, or excessive weight loss can significantly interfere with menstrual cycles and ovarian function. Stress. Chronic stress can disrupt menstrual cycles, potentially leading to delayed or absent periods. Causes of no menstruation at 20 years old. Thyroid disorders. Thyroid dysfunction can affect menstrual cycles and ovarian development. Genetic factors. In some cases, delayed menstruation can be inherited, meaning a mother or sister may have experienced the same issue. Causes of no menstruation at 20 years old. Uterine abnormalities. Certain uterine conditions like septate uterus, a divided uterus, or uterine malformations can interfere with menstruation and ovarian function. Causes of no menstruation at 20 years old. Medication use. Certain medications, such as birth control pills, antibiotics, and cancer treatments, can have a temporary impact on menstrual cycles and ovarian activity. 2. Impact of no menstruation at 20 years old. Challenges with pregnancy. The absence of menstruation implies no ovulation, making it challenging to conceive naturally. Reproductive health concerns. Lack of menstruation can be a sign of underlying health issues that require timely treatment to avoid long-term complications. 2. Impact of no menstruation at 20 years old. Psychological impact. It can be emotionally challenging to experience a lack of menstruation while peers have begun puberty, leading to anxiety, sadness, and low self-esteem. 3. Solutions for addressing no menstruation at 20 years old. Medical evaluation and diagnosis. The first step is to consult a gynecologist for a thorough examination and investigation into the underlying cause of the delayed periods. 3. Solutions for addressing no menstruation at 20 years old. Treating the root cause. Depending on the diagnosis, treatment options can include hormone therapy, medication for eating disorders, thyroid treatment, or psychological counseling. 3. Solutions for addressing no menstruation at 20 years old. Healthy lifestyle habits. A balanced diet rich in nutrients, regular exercise, stress management techniques, and sufficient sleep can support overall health and enhance treatment efficacy. 3. Solutions for addressing no menstruation at 20 years old. Regular health checkups. Routine medical checkups are crucial for monitoring health status and detecting any potential irregularities. Important notes. Avoid self-treatment. Never attempt to self-medicate without consulting a medical professional. Track menstrual cycles. It's essential to record any menstrual changes or irregularities to share with your doctor. Important notes. Maintain a positive outlook. It's important to stay optimistic, seek emotional support if needed, and trust in the effectiveness of medical care. Conclusion. Not having your first period by 20 years old is a health concern that demands prompt attention. Identifying the root cause and receiving appropriate treatment can improve reproductive health, address psychological concerns, and increase the likelihood of future fertility.